News Weekend.
Hello, everybody, and welcome to our 3 live hours of KRON 4 News Weekend. I think it's chilly outside,
you
is it
you
not?
look very festive, or you're very cold.
Oh, I'm trying to stay warm.
Yeah,
I think everybody
it's cold
is.
this morning. You got the diagnosis, went through the grueling chemotherapy and radiation, or both, but what happens after the cancer treatment? Representative from the Northern California Cancer Center joins us in studio to talk about that.
In recent months, the news headlines reported a drop in cancer deaths. That's hailed as a turning point in the battle against this deadly disease. In fact, more people than ever are surviving it. That's the good news. But for the longest time, the focus has been on finding a cure, developing drugs to root out the cancer. But researchers are now finding that some of those same drugs are having long-term after effects, sometimes almost as debilitating as the cancer or even causing the return of cancer. And now those survivors are back at the doctors, asking the physician for answers to recurrent pains for which he or she has few answers. Joining us this morning to talk about this, Pam Priest Naeve. She's the Director of Community Education for the Fremont-based Northern California Cancer Center, which has been a great leader in the Bay Area in educating the community around issues of cancer. Well, this morning the center is holding a conference for survivors and caregivers titled, "So Your Cancer Treatment is Over, Now What?" Welcome, Pam. Good to have you.
Isabel. Nice to be here.
Now, I think that it's interesting that there's conference already sold out, 335 folk pushing the envelope on the attendance. Does this tell you something about the need to know?
Oh, it's huge. We have 10 million survivors now in the United States. They don't know what to do when their treatment is done. We have a situation which we call lost in transition. They have to move from their oncologist, who's taken very good care of them for a long period of time, to a primary care physician who doesn't know what the long-term side effects are, because people are living longer than ever before. We have better diagnostics, we have better treatment, and now we don't know what to do.
Give us an example or two that you know of long-term after effects.
Well, one very serious one is cardiotoxicity from many of the treatments, whether it's radiotherapy. Some chemotherapy drugs create cardiac problems. And we have not been able to track those because people didn't live as long as they are now. Thank goodness they are, but we have this issue. We also have issues around joint pain. We have sexual function issues. If you're young and want to date, what do you tell your potential partner? How do you tell them you've had cancer, and how do you talk about the very intimate issues? It's very complicated.
And the thing is that research has been focused for the longest time on that drug cure.
Right.
And how long does it take to accumulate information or research on the after effects? Because they've also been looking at that for some
Well,
time.
they've been looking at it. It's relatively new. One of the things we're doing today is surveying the 350 people come in. We have a 50-question survey to try to gather information from them. This is a new field of research. We're doing it at the Northern California Cancer Center. There are other groups doing it around the country. But it's relatively new. Not everybody has the same side effects, even though they've had the same drugs or they've had the same treatment. And many of the physicians who don't know what to do don't know how to treat them because the research isn't there for the primary care doctors. So we have to get that information quickly.
I must confess, being a cancer survivor, that at this stage, about 9 years after my treatment, I've begun to feel what I think are what I guessed might be after effects. And it was only after a visit to a Hodgkin specialist, because I had Hodgkin's lymphoma, did he say, well, there's this possibility, this possibility. And I said, you know, thank you for telling me I'm not insane.
Right.
I mean, because there was this sense that nobody, that I couldn't get someone to listen and take me seriously. And I imagine that that's what a lot of cancer survivors feel like.
I think it's very common. One, there is this constant fear of recurrence. And you're always looking over your shoulder. And every ache and every pain becomes a cancer ache and pain, when it may not be. But it's very problematic, and it's very hard for the primary care doctor because the oncologist doesn't give a discharge summary. They don't say what your treatments have been, the dates you've received them, the dosages. And so when you're handed off to your primary care doctor, he or she doesn't know what to look for.
Is there not a movement, not only a survivorship movement going, but a whole move to push legislators to require this kind of a long-term, diagnostic, prognosis, et cetera, et cetera?
Well, I think there's a lot of discussion about the big issue is time and money within the healthcare practice. The oncologist only has so many patients they can see a day, and then the discharge summaries take a very, very long time to prepare. Then you transfer the primary care physician, who may get 7 to 10 minutes per patient. And that's stem to stern, and now you're adding this additional layer. It's very complicated. Legislating it isn't going to give them more time.
Very quickly, what are the issues you're going to address today at the conference?
There are three major issues. We're going to look at all the medical issues, including the long-term pieces. What are the follow-up things that need to be done? Psychosocial issues and financial issues. What about life insurance, health insurance, employment, and your family?
And you've touched on issues that actually impact people in general, the whole health care issue, the system that isn't working, and the high cost of care and the lack of insurance. You've got it all. When you come up with all the solutions, come back and bring them to us.
I'll be in touch.
Thank you, Pam Naeve. Here it is, the Cancer Survivor and Caregivers Conference, 8:30 to 3:30 today. We're telling you about it, but be jealous you can't go because it's pretty much sold out. But if you do want to know more, obviously you can visit the website for the Northern California Cancer Center at www.nccc.org. They have plenty of information and can lead you to other resources. Thanks very much. Good to see you.
Thanks, Isabel.
Marty?
All right, thank you, Isabel.